architect in the medical IT profession. Healthcare informatics consultant. Also worked in Mimos heavily, and also now in Qatar. Experience from the Motorola Software Research Center, and have various experiences of implementation across Asia as well as Australia, UK, and now in Qatar and Middle East, right? So I would like to hand over to him, because I understand that people in this crowd is a mix of some people from the medical industry, but mostly non-medical or those that want to come into this industry. So we, as part of our educating series, we want to bring in a consultant, an experienced person, to give background on these kind of things, right? So hand over to Mr. Saravanan to take it forward. Thank you.
Yeah, thank you. Okay, we'll spend roughly about 30 to 40 minutes going through the slide. So there's two main purposes for this content. Firstly is to introduce healthcare IT primarily. That's purpose number one. And quickly after that is to look at the training opportunities as well as the job opportunities in this healthcare IT industry. I hope everyone's able to hear me well. If you can't, you can message Gajen, he'll be in touch with you. So first, before we starting, right, we can look at who is this for. Everyone's going to spend about 1 hour in this session. So it's good to know that who you are, where do you come from. Depending on your background, this session or the future actual certification will benefit you in various ways. So we'll go through one by one. First category of people is that you are from a generic IT or you're from a different industry. So you may be from a banking industry, you may be from an oil and gas industry, right? So how will this benefit you? So what will enable for you is that you will be able to venture into a growing industry. I will have to stress on the new and growing, and it's a traditional industry, this healthcare IT, because if you look at the technology adoption in various other industries, take banking, take education, even agriculture for that fact, technology has, fintech especially, how can I forget fintech, right? Fintech especially, right? Technology has absorbed itself into these industries for longest time, and be it blockchain or cloud computing has picked up massively. But such is not the case in healthcare. Healthcare is very traditional. Up until that, you still find many, in fact, hospitals, clinics, still using paper and pen. So if there's one industry poised just in the right time to be disrupted, then this is the one. This is the healthcare, this is the industry to be disrupted, and it's a good time for you to enter the industry. I'll tell you why in a while. Next category of people is that you are from healthcare IT. Probably you are a software engineer, probably you are an infrastructure engineer in the healthcare industry. You have been maintaining a hospital system, or you work in a clinic environment, right? As far as for you is concerned, now, because healthcare IT is so proprietary, if you are working in a particular hospital and you are managing a particular system, most probably your knowledge is limited to that system or to that hospital, right? Hence, it will be difficult for you without formal knowledge, formal training, for you to pick up another system, another hospital, or even to move out of your current environment to a different country, for example, because healthcare is very customized, very specific to a particular environment, be it company or country or even region, right? Of course, being certified, it's very important. Now, I understand there's many certifications available, but most certifications are horizontal in nature. So if we take Prince2, CISM, CISSP, PMP, ITIL, these are all what we call as horizontal certifications. So they will cover many aspects, many industries, right? It's good to have horizontals, but when you want to get into an industry, you need to be specifically certified in that industry, all right? So this is one such certification for healthcare IT. And of course, if you're already from a healthcare IT background, it's good for you to be networking within healthcare IT, be in touch with the GKKs, the industry leaders. We have a group of them in the GKK. Okay, and of course network accordingly. So like, for example, like myself, I've been invited to take on this session for GKK's company. All right, moving on. Next group is that you're from academic background. Excuse me. The reason we have this category is that we noticed that we have some students joining. We also have some lecturers joining. All right. So this will help you in two ways. Okay. If you're a student, you can choose to venture in this into this industry. Let it be for your research, for your thesis, you know, even let's say you want to venture and do your industrial training here for your internship. This is one good industry for you to do it. It gives a lot of opportunities. And as a lecturer, you either can guide your students into this industry to do research, or you yourself can do research or probably your PhD and further advancement, right, in this field. Last but not least is that you are not from IT, information technology at all right? We also have such participants. So if you're from that background, you may be wondering, how good is it for you? Now, the truth is, we equally need people who are not from IT. Because if you look at software development, right, the initial part of software development is not technical at all. It has got to do with understanding the workflow, doing business analysis, documentation, a lot of documentation. And for this, we need people from finance background. We need people from medical background. We also need people from documentation background. Those who are very good in English, for example. Of course, we also have doctors right now, actual medical doctors who were practicing before, joining software teams in healthcare IT for various reasons, okay? Mainly as SMEs, subject matter expertise. So this will actually benefit all this category of people, all right? Now, if you fall into any other category of people, I can't think of any personally myself, but if you do come from any other category, please message us and we will take up the question and we'll try to address you later on towards the end of the session, all right? Okay, now that we sorted out who you are, let's have a quick introduction, sort of background to healthcare IT, where it came from, very, very roughly, because 2 hours will not be sufficient for me to cover the basics of history, but we will go through very, very roughly, all right? The earliest history of any computer usage for medical records is in 1960s out of Mayo Clinic, all right? I think many of you will know Mayo Clinic. They are quite famous both for their healthcare practices as well as their healthcare IT practices. Okay, later on in 1980s, Lockheed Martin, which is the weapon trader, weapon manufacturer in the US, came up with the official systems to be used for a group of hospital, networked as well as exchange information using protocols known as HL7 and DICOM. I'll cover what is HL7 and DICOM in a while, but for now, just bear with me. So these are the two earliest protocols was used, okay? And then the 90s, something else happened. Now, this is very relevant to Malaysia. I'm sure many of the participants primarily are from Malaysia, okay? I'm proud to say that Malaysia was one of the first countries in the world at the time, 96, to come up with a country level national telemedicine blueprint, all right? And the very next year, Hospital Selayang went live with a system called Cerner, and it was one of the first, again, total hospital information system, all right? Then we have a host of other history, like Solution Protocol was established, and there was a consortium, and this under our Tun M Prime Minister at the time. The idea was to have one system nationwide, all hospitals, government hospitals sharing medical records. It's very utopian at the time, and that's what it is right now. Until today, it is still a utopian idea because it never got implemented 100%, but that's a story for a different day. Moving on, again, see, the US was driving healthcare IT for the longest time, and they are still driving it for the few reasons, actually, all right? So HIPAA came about. HIPAA is a Health Information, Insurance Portability and Accountability Act, all right? And Electronic Health Record System was established. And the idea was within the 10 years from the early 2000 is to have nationwide medical records done. All right. And it was a country of about 200 million people. It was really a huge ambition at the time. And they did manage to do it to a large extent under Obamacare. I'm sure you guys know. Obamacare really put the whole program on steroid, and they went ahead. And a quick check, quick information. In 2003, see, throughout from 96 until the early 2000, or in fact mid 2000, Malaysia also went through many cycles projects in healthcare. One of a prominent one is lifelong health record project or lifelong health plan. There's 2 phases of the project actually, right? But it didn't pick up as well. It was a part of the telemedicine blueprint. It never got picked up, right? Moving on, then the national HIT was established out of the US. And fast forward, here we are right now. As many of you would know, healthcare IT is still traditional. Doctors are still using paper and pen. I'll just stop right there in terms of the history and let you know that our data is in the progress of going to the cloud right now. We have many countries who have established national health database. IoT adoption is happening. PHR, okay? PHR is your patient health record. It's on the opposite side of the EMR. EMR is what happens within the hospital. EHR is what happens nationwide. So PHR is being empowered right now, thanks to companies like Apple, Google. Many of you will be wearing I'm not wearing an Apple Watch. I'm a Garmin guy. Many of you will be wearing an Apple Watch. So your Apple Watch is one of the enabler of PHR, which feeds data into the cloud, right? So when you have a lot of a lot of data, you have big data, and then you have blockchain and so on. I'll cover the rest later on, but here we are right now, actually, so far. Okay, that's a quick overview of